Welcome to United We Spay, the show dedicated to promoting affordable spay-neuter services nationwide. Each episode delves into the heart of the movement, sharing inspiring stories and driving positive change. Our goal is to raise awareness, educate, and empower, addressing overpopulation's root causes to ensure every animal has a chance for a better life. Hosted by Stacy and the United Spay Alliance team, we're on a mission to change lives. Fed up with the fixation on symptoms in the animal welfare conversation, it's time to change the narrative. Join us on United We Spay, where we make a difference by spreading knowledge and building a compassionate world for animals. Let's put prevention first and spotlight spay-neuter in the animal welfare space.
You are listening to United We Spay, a podcast from the United Spay Alliance. United Spay Alliance works to promote accessible, affordable, and timely spay-neuter services because an ounce of prevention today can prevent untold suffering tomorrow. Spay-neuter. It's public health for pets. I am Stacy, a United Spay Alliance board member and host of the show. Today on United We Spay, we are talking with two guests, Linda Chitwood and Denise Bynum. Linda is the founder of Homeless Animals Relief Project, a small nonprofit laboring since 1997 in rural North Mississippi to reduce pet overpopulation by providing free or low-cost spay-neuter to cats living with the poor and to feral cats. And Denise Bynum began as a volunteer for HARP, trapping and transporting cats for spay-neuter surgery while working as the director of nursing instruction at Northwest Mississippi Community College in Senatobia, Mississippi. After her retirement from Northwest in 2020, she began helping Linda, the former director, write grants and began answering the calls from cat owners and making surgery appointments. She became the director in July of 2022. Since becoming director, she's increased the number of cats fixed by HARP, increased grant and donor income, networked with various rescues and local shelters to find homes for cats and kittens, recruited more veterinarians, and launched a quarterly newsletter. HARP was also chosen as one of the 30 best nonprofits in Mississippi in 2022. Linda, welcome to the show.
Thank you for having us.
Denise, welcome to the show.
Thank you. Good to be here.
So, Linda, let me ask you this question first. Why are you passionate about spay-neuter?
I moved from Memphis, where I had lived all my life, a big urban center where there's lots of rescues and humane societies and quite a few options for pets, and down to Mississippi, where I found that it's a veterinary desert and there's a lot of low income people who might want to provide care for their pets but cannot. Lots of feral cat colonies and just a really serious overpopulation problem. I started trying to help just individual cats get just paying out of pocket, trying to find people who are poor and getting their cats to the vet. And then one day I got a call from a lady at a trailer park in Tunica, Mississippi, a low-income area, and she said the trailer park manager was offering the children $5 for the head of every cat that they could bring him. This is infuriating, horrifying, upsetting, and I even hesitate to mention it. But I called him. He said he was just kidding, but the person who called me told me the children were very busy. And that's how I got started and saying we have to do something about this, that cats and dogs are so seen as nothing but pests. And that's kind of how I focused at first with most people is I'm operating a pest control service for you. I hate that it has to be that way, but we've moved more now towards a compassionate society, I think. But that was how I got started.
Excellent. Denise, would you like to share a little bit about your story about how you ventured into this spay and neuter world?
Well, my first experience with HARP was trapping a cat, actually just getting it to go in a cage from a convenience store in Senatobia that it was living in a culvert and very scared. So I called my friend Meg, who's on the board of HARP, and we got the cat and she offered to take it. It was feral. To a HARP spay day the next day. So she did that, brought me the cat back. Of course, I still have her. I kept that cat. She's not feral. So that's my first experience with HARP. So I knew someone low income. I called Linda and transported that lady and her cat to get fixed. Then Linda contacted me, would I be interested in transporting other cats? I can't remember if she heard I was planning to retire and saw an opportunity for a new volunteer. So she asked me if I was interested when she was thinking about retiring in maybe answering some calls or, helping when I had time. So that's where I started.
Excellent. Excellent. Linda, what I would like to focus on right now is being on the United Spay Alliance board. We talk a lot about access to spay-neuter care. And it seems to be very focused on the urban areas, the metropolitan areas.
Absolutely.
What are we doing in the rural areas?
And that's where I think part of our biggest problem lies. There's a lot of urban areas who've got spay-neuter, low-cost spay-neuter clinics, high-volume clinics. There are some rural areas who are fortunate enough to have a team of, high-quality, high-volume spay-neuter people come to their area. But in our area, it's rural Mississippi. It's low income traditionally, and that gap is widening over the past almost 30 years that I've been in this. That gap is really widening. We're seeing more and more poor people. And while we're making progress, which I never thought I'd see in my lifetime, I never thought I'd see the results of my labors, but we are. We're seeing those results. And yet we still have so many indigent people, and they have lack of transportation. We only had 2 veterinarians in our whole county until a year or 2 ago. Now we have 3. But there's lack of transportation. There's lack of a lot of people with disabilities, elderly, unable to trap, unable to get the cat into a carrier, unable to load it. So we're still facing a lot of problems with transportation issues, getting them to vets. Denise has been wonderful about recruiting more vets, but we've still got to be able to get these cats there. And of course, funding to pay for surgeries. Our vets are wonderful. They're working at greatly reduced cost, but there is still a fee that needs to be paid to cover them.
So I'm going to jump over to Denise for some questions in a few minutes. But at this point in time, I'd like to follow up with that conversation that you just brought up there, that topic,
Sure.
Linda, that you brought up of, sort of what you've seen over time. And in terms of, veterinarians, so we have a national vet shortage.
Yes, we do.
Technician shortage.
Yes.
And then you talked about fundraising or funding. Of those 3, where are the greatest pressures being felt in the rural animal welfare and spay-neuter space?
I guess, and it's a tough one because our vet who works the most with us, who is a high volume vet, she spayed 33 for Denise yesterday between 9 a.m. and 1 p.m. But she's 70 miles from us. We have very few clients who have the gas money or the car that will make it that far. So veterinarians is a huge part of it. But at the same time, it wouldn't matter if I had a dozen vets clinics right here if I didn't have funding. So the funding is hard too. I think it's a little bit easier for our group because we have a proven track record that we can show to people. But there's just a limited number of times that you can approach donors before they get fatigued with hearing about your fundraisers and your grant requests, things like that. So I guess funds right now are going to be our greatest issue.
Do you find that your donations come primarily from the local area, or is your donor base beyond your local community?
Well, now Denise has expanded the donor base with her newsletter and with a Facebook page, which I didn't do a Facebook page or a newsletter. I preferred, and I still would, I'd rather get one person to give me $500 for these cats than to get 50, give me $10 each. 50 thank you notes is a lot to write. I'd just rather fawn over one person for the 500. And so we have been very blessed to have some benefactors who will give like that and will give when they're called upon. And it will be in the 3 to 4 figure range, and at one time even in the 5-figure range. So that's where I prefer to go. But, as those people age or find other causes, you got to stir up more interest in that. So the fundraising, and Denise has been great at that and has done a better job of that than I have, and about getting the word out. But no, they're not our fund. Most of the people who give, all of our clients will give what they can, and bless them. You have a lady who gets $973 a month Social Security. That's what she's living on. And you fix her cat, and she says, as soon as my check comes, I'm going to send you $100. I don't want to take her $100. I just don't want to take it. But she wants. She's grateful, and we fixed her cat. So we do have smaller amounts coming from there. The big donors that I've had have been in other states, northern states, California, places like that. And in that sense, if I don't mind saying it, being in rural Mississippi, because a lot of the country has an opinion of Mississippi as being a very backward, just not a very clever place to live. So, and I kind of, play that up and trying to get money from them. Here we all are in poor Mississippi, and y'all have got electricity and internet, and here we are trying to make it by. And so I kind of play that up. Maybe I shouldn't mention that, but yeah,
we do what we need to do in order
for the cats.
Get to the objective that we need to, which is getting access to as much spay-neuter as possible. So Denise, I'm going to turn the conversation over to you for a few minutes here. You've joined as a leadership in July of 2022. In that period of time, was this job what you expected?
It was, and more. Of course, Linda's shoes were some big shoes to try and fill. And I will say she has stayed somewhat in the background to the public and to the clients, but she has been behind me, encouraging, supporting, suggesting, and helping with grants, with connections with the people she knew in the past that were donors, and just anything she could do to help. And for that, I appreciate. But it's been challenging. But I love what I do. I love going out and trapping cats and helping the clients and hearing their appreciation. And I think it's opened my eyes to the suffering, not only of the animals, but the people that I see, how much they love their cats and their animals, and how thankful they are. They'll tell me, I've been praying for some answer to help me fix these cats so that I can continue to feed them. If I have any more, I already have 15. I can hardly feed them. And I have people asking for cat food. They can't even afford to feed the ones they have. And I have donors that will give me cat food that I can give to the clients. So it's really opened my eyes to know how privileged and blessed that I am. So I think that's been the biggest surprise to me.
So let me ask you a little bit about your cooperating with other groups. And I think Linda also mentioned about bringing on board some more veterinarians. So, tell me a little bit more about what that means. Cooperation, collaboration. Do the groups talk to each other? Sometimes in some states, there's not much conversation.
Yes, we connect on Facebook. That's been a great platform. I'm tagged on a lot of different groups, that to let me know about issues, people that have cats that need to be fixed. And we have a lot more calls. I don't know that there are any more cats than there used to be, but I think the word is out about HARP and the word of mouth, and it's on Facebook. So I have met other groups at Spay Day. When we go to the clinic Linda was talking about 70 miles away, there's a rescue group there, Whisker Wishes. We've gone there for Spay Day, and they have taken some of the kittens we have and taken them into rescue. Also, we have a close rescue here, Pals of Paws. I've partnered with them. They've taken probably 200 or 300 kittens from clients that have kittens to take into rescue. And we just can do a lot more together than we could do separately. So that's been a great thing. I would find kittens in the past and I didn't have anything to do with, anywhere I could take them. So now I do, and we're able to help those kittens and take them from those clients that want to give them up so that they can continue to feed the cats that they have. They also, that rescue helps with those kittens, when they're sick or, I don't have the funds to help as many cats and kittens there that need medical help. And we try to help those cats. The vets will sometimes donate the care or do it at very low cost. And we're able to actually help cats that are injured or are very sick. So some people, the cat is so sick it needs to be euthanized, and they don't even have the money to do that. And we want to stop suffering from overpopulation or from, illness if we need to. So there's another rescue that I work with, and they help trap 9 Lives of Oxford. I've worked with the humane societies from Tunica and Panola County, and we've partnered where they would actually pay for some. If we had a big colony in their county, they would pay for some of the spay-neuters. So, HARP does have a really good reputation, and thanks to Linda and her work in the past. And so we've just expanded that network also with the different shelters. I work with our shelter here, and I'll say they give our number to anybody who calls that has cats and kittens. And those people have actually decided to keep their animals and not surrender them to the shelter if somebody will fix them. So we've been able to do that. Our shelter has not euthanized any cats for space in over 2 years. So when I find a cat, they will take cats that I find that don't have homes or wandering around the grocery store in town or somewhere. They will take those cats when they have room. I've met people that fostered. I found fosters for the shelter, for the rescues, and then just on my own fosters that will keep cats. So I love networking and finding other vets. Linda's really worked too in finding some vets in the area. And I actually had a vet call me, a new clinic that wanted me to go and help a gentleman. Has had a stroke. He had 15 cats. And I asked her if she could fix some of them at the price I could pay, and she said she could. So actually 10 of his cats were in the group yesterday that were fixed. So by helping this gentleman, then I believe we have a new vet in an adjacent town that will do a few. They have to work the cats in with their clinic appointments, but sometimes that really helps because a client can get to a local vet versus they can't bring them to me or, to 50 to 70 miles away, but they could get to their local vet. And that's really helped. The vets have been great to work them in, with their appointments.
Excellent. Thank you. So, Linda, I'm going to close out this podcast with a couple of questions for you. Many of the organizations that we'll be profiling are organizations that actually have a spay-neuter clinic. When you started back in 1997, do you aspire to having a spay-neuter, or was it more about making the connections?
I aspired to having a clinic and still do, but I don't know that that's going to be in our future. What we did when we started at that trailer park, the manager who was promoting cruelty, I was able to find out who the wealthy family in Memphis who employed him, and he was fired that same day. And they gave us an empty trailer to work in. And we bought our vets and our equipment down there, and we fixed every animal in that trailer park, dogs and cats, that day. From there, we started just working and donated space. In 2005, a foundation gave us the money to buy a used travel trailer and a used anesthesia machine And we used that for the next 15 years and working in there. So, yeah, I guess we did have a spay-neuter clinic, but it wasn't like a Monday to Friday type thing because I'm like most people, I still had a job. I still had things to do. And no one in our organization is paid. We're all volunteers. So I couldn't do as much as I would have liked to. I still would like to see at some point a freestanding spay-neuter clinic in rural Mississippi. We have many counties here that have no vet, none. Even if you've got a car that will go that far, even if you're that interested, you're going to be driving 100 miles to get your cat to the vet. So I still aspire to that. And maybe that's something that could happen in my lifetime.
And Linda, if folks are interested in finding out more about your organization, how would they do that?
We're on the internet, homelessanimalsreliefproject.org or facebook.com/HARP Senatobia.
Linda, is there anything else you'd like to share with our listeners today?
The one thing that I think that I've learned over all these years is that just do it. Do not wait until you have everything all set up and everything. And don't approach an organization, a foundation for $2 million to build a spay-neuter clinic. Get your neighbor's cat fixed first. Get the cats at the McDonald's fixed. Get your feet wet. Just get one done. I've had people call me and ask me about it, and I'll talk to them about how to get started. And 2 years later, they're still calling and still thinking about it. They've yet to fix the first cat. Just get it done, even if you have to pay out of your pocket or you have to do a little fundraiser at work or among friends. Start getting them done. One cat fix saves thousands. You do not have to do 40,000 cats a year to make a difference in your community. One cat spayed makes a huge difference in your neighborhood.
Excellent. I want to say thank you to both Linda and Denise for joining us today. Thank you all for listening. If you like this episode, be sure to share and subscribe. We'll be releasing a new episode each month, digging into important conversations surrounding spay-neuter throughout the United States and around the world. For more resources about spay-neuter and learn more about our work at unitedspayalliance.org. That's unitedspayalliance.org. Get in touch with us anytime by emailing info@unitedspayalliance.org. That is info@unitedspayalliance.org. Until next time, thank you.